Good evening and welcome to Talk Black. I'm your host Karita Hurley, and today we will be discussing cultural competence and cultural humility and how it relates to health disparities. And your first person that you will be hearing from today is Kimbrell Smith.
Hi, my name is Kimbrell Smith, and I will be discussing the three articles. The first one is entitled "Implicit Racial Ethnic Bias Among Healthcare Professionals and Its Influence on Healthcare Outcomes: A Systematic Review." In the United States, people of color face disparities in access to health care, the quality of care received, and health outcomes. The attitudes and behaviors of healthcare providers have been identified as one of the many factors that contribute to health disparities. Implicit attitudes are thoughts and feelings that often exist outside of conscious awareness and thus are difficult to consciously acknowledge and control. These attitudes are often automatically activated and can influence human behavior without conscious violation. My next article is Changes to the Design of the National Health Interview Survey to Support Enhanced Monitoring of Healthcare Reform Impacts at the State Level. The NHIS is an invaluable data resource that has been critical to understanding the trends in health and health behaviors in the United States. Unlike other federal surveys that measure health insurance coverage, the NCHS was able to quickly add questions in response to the information needed generated by the ACA. The new questions have allowed researchers to monitor the impact of health reform on health insurance coverage, health care access, and the utilization, and can be used by policymakers who continue to make implementations and operational decisions related to health reform. And finally, the last article that I will be presenting is the Organizational Advocacy of Cultural Competency Initiatives, Lessons for Public Administration. Cultural competency initiatives in the public sector continue to grow, from programming efforts to organizational policy and implementations. The initiatives build off decades of similar experiences and practice in associated fields of public administration. The study reviews existing advocacy in healthcare, social work, and other public sectors organizations. Specifically, the study reviews public service academics, associations, honor societies, and accrediting body practices that, by example, can help by informing, guiding, and advocating cultural competency initiatives in public administration. Future implications and opportunities are explored and presented. Thank you. And our next presenter will be Jessica Young.
Good evening, and I am Jessica Young, and I will be presenting to you racial health disparities in America. And one of the reasons that racial health disparities exist in America is due to the negative biases that are applied to people of color. And there is a significant bias against African Americans, Latinos, and Native Americans that are of darker complexion. And usually these biases come about during the patient to provider. And another reason why there are racial health disparities amongst these groups is due to lack of health insurance. 18.9% of African Americans lack the necessary amount of health insurance. 30.3% of Hispanics lack the necessary health insurance, and 13.8% of the Asian population lack the necessary health insurance for their access to care. These groups are more likely to experience poor quality of care due to their ethnic background or language barriers. And our next speaker would be Candace Bogan.
Hi, my name is Candace Bogan, and today we will be talking about cultural humility and how it relates to racial health disparities. To start off with how the two relate, we have to define cultural humility and racial health disparities. Cultural humility is the ability to maintain an interpersonal stance that is other-oriented or open to the other person in relation in aspects to cultural identity that are most important to the person. Cultural humility is different from other culturally based training ideals because it focuses on self-humility rather than achieving a state of knowledge or awareness. Cultural humility was formed in the physical healthcare field and adapted for therapists and social workers to increase the quality of their interactions with clients and community members. What are health disparities? According to the Health Resources and Services Administration, health disparities are defined as a population-specific differences in the presence of disease, health outcomes, or access to health care. And racial ethnicities such as Blacks, Hispanics, Asian Americans, Native Hawaiian, and other Pacific Islanders, American Indian, and Alaska Native. So racial health disparities is health disparities related to ethnicity. How it relates to cultural humility and health it relates by realizing that different nationalities are subject to different treatment due to different customs, rituals, and beliefs, such as expressing pain differently or reacting differently. As someone working in the healthcare field, you have to be aware of these customs, rituals, and beliefs and possible language barriers that may accompany someone of a different nationality. Just as most African Americans seem to avoid the doctor until the last minute, so others are accustomed to ways in which they handle health care that may seem odd but reasonable to them.
And next we have Taylor Humphreys, and she will be discussing cultural competency. And then after that, we'll have the wrap-up.
Greetings, my name is Taylor Humphreys, and I will be talking to you about cultural competency. I don't know about you, but whenever I hear the phrase cultural competence, I can't shake the feeling that the concept is a bit arrogant. The idea of cultural competence is a great thing. If I were routinely working with a group of individuals of a different culture than my own, I would want to learn everything I could possibly know about the culture so that I could understand and relate to these individuals as I possibly could. But when I consider the notion that a healthcare provider should be culturally competent, my competing feelings are that the notion is once both presumptuous and overwhelming. Let's start with the definition. Cultural competence is the ability to interact effectively with people of different cultures and social-economic backgrounds, particularly in the context of human resources, nonprofit organizations, and government agencies whose employees work with persons with different cultural and ethnic backgrounds. Cultural competence comprises 4 components: awareness of one's own cultural worldview, attitudes towards cultural differences, knowledge of different cultural practices and worldviews, and cross-cultural skill. Developing cultural competence results in ability to understand, communicate with, and effectively interact with people across cultures. And now we have Karita Hurley with the summary.
Hello once again, I'm Karita Hurley, and today we had Kimbrell Smith, Jessica Young, Candace Bogan, and Taylor Humphreys, and these ladies discuss cultural competency and cultural humility and how it relates to health disparities. Thank you again for joining us on Talk Black, and have a wonderful day.
Thank you for joining us on Talk Black. Good night. Mwah.